your permission to use this video for educational purpose on internet and for publishing. Do I have your permission?
Yeah, you got my permission.
Excellent, thank you. Now, you had a scoliosis and we did the surgery just 2 weeks ago. First of all, how bad was the pain in the legs before the surgery? You said the pain was really bad, but how bad was it?
Well, it started out gradually, got more all the time.
And
when I got weak,
You got very weak. You couldn't even drive or do
couldn't
basic
do
things. Yeah. And we did the surgery 2 weeks ago, just 2 weeks ago, and you're coming for follow-up. How long did you stay in the hospital?
3 days.
Just 3 nights?
Yeah.
3 days or 3 nights?
Yeah.
Okay. And then I understand that your leg pain is practically gone right now. Is that correct? And I understand that only positioning activity, the position like twisting.
I'm just standing on this thing here. That's all.
Okay.
I haven't tried walking on my own yet, but
but overall,
that seems to be pretty good now.
Yeah,
excellent.
The pain is getting up and down.
Okay.
Twisting, getting in and out of bed,
and
in and out of his chair. Once he's up, he's good.
Okay.
Once he's down, he's good.
Okay, but we are just 2 weeks after the surgery, so what you are describing is very typical, and I think our people who watch this, they need to know that. Now let's look at the films here. This is the pictures before the surgery where we had the scoliosis, and I measured the Cobb angle, which is 21, more than 21 degree, and after the correction, the Cobb angle is now just 1 degree. So we could achieve a 20-degree correction of the scoliosis in a minimal invasive way. And I like, if possible, as well, is it possible for me to look at your incision on the back and show it to people as well, how we did the surgery? No, you can just sit there. You're fine. You're fine. I'm just going to open this. I just want for the people to know that with the minimum amount of the surgery we did, we could achieve the 21-degree correction, and I think that's important. And here we are obviously just 2 weeks after the surgery. This is where we put the cages in, all 3 cages are in.
Okay.
These are where the screws went in, 4 screws on each side, and here's where the rod was inserted.
Okay.
And it's healing well. In few months, they are going to fade and they are going to be barely visible.
Good.
And obviously it's not about the size of the incision, it's what happens on the skin that makes it minimal invasively. So overall, I'm very happy with the results so far. Obviously, we're going to follow up. I like as well to do a little more physical therapy to show you to teach to you how to go from one position to another.
Yes.
But overall, so far, are you okay after the surgery? Are your symptoms better controlled now?
Yeah.
When we are just 2 weeks after the surgery, we have a long way to go, but I think as well we are on a good path. Thank you very much for the interview.
You bet.